This month, Hamilton County government launched a new initiative to help fight the opioid crisis. The Overdose Prevention Team, through Hamilton County EMS, will deliver life-saving medication to people with opioid use disorder and connect people struggling with substance abuse to recovery resources. Hamilton County Mayor Weston Wamp says the initiative is the first of its kind in the state of Tennessee. I spoke with Mike Garren, Public Information Officer and Recruiter at Hamilton County EMS, Katrina Hereford, the county's Program Manager for Overdose Prevention, and Christy Cooper, the county's Administrator of Public Safety. Christy, Mike, Katrina, thanks for joining us.
Thank you.
Thanks for having us.
Appreciate it.
Tell us more about the Overdose Prevention Team.
About a year ago, Mayor Wamp gathered several of us, actually in the library here at UTC, and wanted some really innovative ideas about what to do with the opioid settlement monies that had come down from the state. And we sat around that table and we came up with this really interesting approach, which is partnering our EMS department with our health department to provide in-home MAT, or medicated assisted treatment, to patients that either are post-overdose or self-referred or referred from hospitals or other agencies. And it's a bridge program, so they can receive the medicated assistant treatment from us and at the same time be referred to our partners at the health department. The navigator there, under Katrina's team, will be connecting the patients to a wider support system throughout Hamilton County and beyond, depending on what the person's needs may be.
And Katrina, tell us more about what the navigator will do as part of this overdose prevention team.
The navigator with our overdose prevention program will assess the patient's needs and determine where they need to be in their treatment once they've finished the in-home Suboxone treatment.
And Mike, talk more about the EMS side of this approach.
We're really excited about this. This is a new service for our community, and our motto at Hamilton County EMS is setting the standard of care. And that's exactly what we're doing. This program is the first of its kind in the state of Tennessee. There's some other states, I know California, North Carolina have similar programs. So we're really excited, and it's a little different for us. We're used to going, treating the patient, getting them to the hospital. This is going to be a little different. If they want help, we're going to be able to follow up with them, doing in-home visits with the peer support counselors, working with the health department, navigating them to get treatment if they want help.
Up to now, it's been responding to an episode, responding to an incident, and then on to the next thing once that incident or episode is passed.
Right. And this is really a great example of community paramedicine. So seeing a need in the community and addressing that specific need. In this case, it's opioid use disorder or any sort of use disorder. And so what we're trying to do is assist people that want to get clean and haven't found the right avenue yet. We're taking it to them, to the home. It's going to be a benefit because when our paramedics and peer support specialists go into the home, they're going to be able to see some different things that maybe clinicians in the hospitals or in clinics don't see. Are they food insecure? Are they housing insecure? Do they have transportation issues? Do they have daycare issues? Do they need employment? So those are a lot of things that we can determine by going into the home and meeting them where they are, that we can refer over to the health department navigator and their team to be able to connect to the myriad support systems we have here and community outreach programs that we have in Hamilton County to provide whatever they may need to help them get over those hurdles that they have.
And this problem, it cuts across the county. We're talking about rural and urban alike.
That's correct. Sadly, this epidemic knows no boundaries. It can happen just as well on Signal Mountain as it can in the inner city. We, as EMS, we service every socioeconomic population in the county. We're excited about this.
What we're able to offer then, the road to recovery is a long one. So in early days of recovery, if you can remove as many barriers from treatment as possible, then that makes that journey to recovery that much easier for the individual. It's about willingness on the individual's behalf to be a part of this. And so establishing trust in those early days is important. To be able to work with not only a peer support specialist, somebody who's been there, who understands how hard it is to be in a place like that, and the navigator to help them get connected to the support that they need. It's a win-win situation. They're removing the barriers and they're getting connected to the treatment they need.
I want to add that addiction and substance use disorder is not always about what we think in the movies. Sometimes it can be because you've had a terrible accident and you have pain that just lingers and you can't get over that pain. Sometimes you've had surgery and these medications have been prescribed to you and you've had the prescriptions and unfortunately you've become addicted to them. Sometimes you've had dental work that has called for these kind of medications. So it's not always what we think of as drug abuse. And Mike's right. It's not always in the economically disadvantaged communities. There are people throughout this county that, depending on where they live, is irrelevant. I would say that their income level is irrelevant. Their socioeconomic status is irrelevant. Anybody can form an addiction to these medications. And we're trying to break down that stigma. And by coming into the home, and we're going to be using unmarked vehicles to come into the neighborhoods. We're not going to be rolling into the neighborhoods in ambulances and sirens blaring. When someone requests to participate in our program or they agree to participate in our program, it's going to be very discreet. Your neighbors won't know, community won't know. During the 5 to 7 days while our peer supports and our paramedics are coming into the community to come into your home to provide the medication-assisted treatment, it's going to be a very confidential relationship. It will be a confidential relationship with the navigator and the team at the health department. And then those confidential relationships will continue as our clients are referred out to the support systems within the community.
And to your question about it being countywide, we're able, if they're in a neighborhood and we're over here at our location, we're able to do telehealth. So they can give us a call and we can meet the individual face-to-face on a phone or on a tablet or something. So we're able to have that meeting right then and there.
And while there has been progress against aspects of this problem, there's more to do. And as you all know, problems that unfortunately endure like this, they also evolve. And you have to try to get ahead of that as best you can.
You're exactly right. And I was thinking as we were talking earlier, examples that Christy told about folks having accidents and pain. And we've had great strides as far as physicians are limited on how much medication they can prescribe, pain medications that they can prescribe patients. However, we know that these folks, if they're truly addicted, they're going to find other avenues. So it's still a problem out there.
The other thing is that this is an evolution. Years ago, whenever the opioid crisis began, it was with controlled substances and it was with prescription-based substances. But it's evolved now to being fentanyl-laced synthetic substances. And we're no longer seeing opioids mixed with fentanyl. It can be fentanyl mixed in meth. It can be fentanyl mixed in cocaine. We're seeing lots of different substances. So it has transitioned just because the community in itself has transitioned as well, too. So these are people who are using very unsafe, very dangerous illicit substances. And to be able to help an individual get away from that substance, it's really important. So we watch the trends as a community and we work on our prevention, our education, and our outreach.
We wanted to eliminate the barriers to treatment. And sometimes that might mean that clients don't want to leave their home. They don't want to lose their children. They don't want to lose their job. They don't have an extended period of time to go to inpatient care. So we wanted to provide this as a different type of program to get the medicated assisted treatment to them and provide the community supports that fit with their lives. Not everything works for everybody. So this is a customized program to try to work with each person where they are on their recovery road.
And for people who want more information about this, people want to reach out and get help, how can they do that?
There's a couple different ways. They can, of course, basics, dial 911. They can reach out to Hamilton County EMS or the Hamilton County Health Department. We'll be able to give you the avenues and any information that you might need. And we do encourage people to call. It's confidential. It's just like all other healthcare things. Your information is protected. And as Christy said earlier, we're doing this very discreetly. We don't want to bring attention to these folks because that's another barrier. People are embarrassed. They don't want to be looked upon in any certain ways. That's some of the avenues that you can get in touch with us.
We're currently hiring for our paramedics, our peer support specialists, and our navigator role. The job postings are open right now at our Hamilton County TN.gov website and also can be linked through the Hamilton County EMS website. So we're hiring 3 teams, a paramedic and a peer support specialist, and then 1 navigator to join Katrina and her team at the health department. So if anybody is interested in those roles, please contact us. Please look for those job postings. We want passionate, caring individuals that have a calling for this type of work. It's not for everyone. We want people that can really see drug abuse and substance abuse as a disease, which it is. So we're looking for the right people to fill these roles and hope we can find dedicated individuals to do that.
All right, Christy, Mike, Katrina, thanks so much.
Thank you, Ray.
Thank you so much, Ray.